Hi, this is Dr. Saxena, and in this our series of trying to achieve this optimal health, we'll be talking something on what is that small thing which can really affect your health in a big way. Today I'll be talking on something called insomnia, the people who are not sleeping properly. This is a kind of thing which is being uh, widely talked. There are a lot of there's a big industry. You have got a lot of sleeping pills. People work on a lot of stuff. Let us understand what is this uh, sleep issues people do have and how we can work it out. What best kind of things. I'm not going to a lot of medical things. I don't want to tell you about the types of insomnia, what is that, but usually if I try to work it out, people usually have something like early morning awakening insomnia. People have something like initial insomnia, falling asleep is it issue. Apart from, you have got something like jet lag, you have got some different things. We can always narcolepsy and all that. This is a something we can talk later. Coming to the what are the effects one may have, negative effects of insomnia. I can always start by bombarding this particular thing. It has been proven chronic insomnia, not getting proper sleep, is associated with a reduction in the lifespan. Um, this insomnia reduces NK lymphocytes, which will hamper your immune system. Chronic insomnia leads to type 2 diabetes, something which there is a lot of peer-reviewed studies now which are showing that particular thing. Chronic insomnia causes a lot of fatigue. You are all the day long. You are almost you believe yes there are some things which are not happening properly. Uh, these are the things. Apart from that, you have got insomnia causes impairment in concentration. This two concentration ability goes down. You have got lot of irritability. The people have who are sleep deprivation, they are much stressed. So these are the few things which we believe is because of rise in cortisol as well as interleukin 6. This lack of sleep causes this particular two things, and that makes now let us see what is this, what are the is it is only psychiatric problem, or it is something like what exactly is this thing called insomnia. Classically defined, insomnia is the inability to fall asleep or remain asleep for an adequate length of time in the absence of external impediments such as loud noise, bright light, and during the period when sleep would normally occur. So, this is the kind of description of this thing called sleeplessness. I had various instances. We try to ask the people who comes to us to correct some of the things like switching off the TV 2 hours when you go before the sleep. Trying to see that all the loud noises and all that has to be curbed out. Don't listen to a debate in the TV before you sleep. Try to see that your light should be, don't keep your cell phones on as a clock. I know some people, they use cell phone as a clock. They just like to see what's the time, and then when they see the light, there's the brightness of the light, that is enough to cause sleeplessness. So what is basically insomnia may vary in intensity from restlessness or disturbed sleep to shortening of the normal length of the sleep and total wakefulness. I certainly see in a lot of 10% of adults experience chronic insomnia. More than 50% experience significant insomnia during any time in their life. So, as a doctor, people who come to me with various problems, probably they don't mention when we ask them, "How is your sleep?" "I don't sleep properly." That is the commonest thing which we are getting into these days. So, what I try to work it out, and what are the things I would like to look into before supplementing any kind of medicine and all that, is trying to know what is the cause, what is the basic thing. I'll be giving you a simplest example where we try to working on this chronic insomnia patient taking a lot of medicines before sleeping, and there are, I can always tell you, I'll just give an example of one of the patient whom we are working with that, and he said, "No, it's a kind of thing." He takes dinner at around 7:30 or 8 o'clock in the night, and he sleeps by 12 o'clock. So when we asked him to take a small kind of oats mixed with some honey or with some kind of milk before going to the bed at 11:50 in the night, and he slept properly throughout the night, there was no problem with the sleep. So here I am trying to put across your sugar levels. If you are so taking a snack before bedtime in that chronic age group people, just having a small snack is going to help him in a big way. So these are the things, and I'd like to tell people we used to follow that particular stuff before going to the sleep. As a children, we used to take a cup of milk, and now I don't believe somewhere I need to. This is a myth basically. Milk does not induce sleep. This is what happens is that you have got tryptophan in the milk, which is suppressed by the other amino acids in the milk. So it doesn't kind of thing. It's only a kind of something like a snack. It acts as a snack. So the other things which I would like to talk is kind of what are the foods which can cause, foods or beverages which can cause insomnia. The first thing which comes to my mind is people taking some coffee at night, usually coffee in the, see there are, I'm just talking about something like a general rule. I have seen people taking a cup of coffee and getting into sleep. Must be there is some exceptions, rules, there are some exceptions. But what happens is that if you take coffee at night, it causes insomnia due to the caffeine content of the coffee. You have got aspartame. Aspartame is usually found in a lot of colas. It's usually found as a sweetener, artificial sweetener, and it causes insomnia because of due to the aspartic acid and methanol content of this particular stuff. People who are on herbs, usually something like ginseng or ephedra, they will have problems with insomnia. Again, people having alcohol has got something like hangovers, and they do have temporary insomnia. Apart from that, I would like to know whether the patient is chronically constipated. If the patient is chronically constipated, he may have insomnia. It is we would like to rule out in cases whether he or she has got something like hyperthyroid, or one of the commonest things insomnia come to us is a symptom of something like fibromyalgia, which is very prevalent in these days, and we see a lot of people suffering from fibromyalgia not properly being diagnosed and worked up properly. Sometimes this insomnia is because of adrenal insufficiency, and we had seen people having depression. Depression is the underlying cause for some insomnias. So it's a quite wide, big kind of thing. It is not just something. It is not some deficiency of something like that. You need to really, you have to be rational, trying to understand what are the things which can help this particular person and all that, based on what are the things which are available with me. So I would not like to go with pharmaceutical drugs, but people sometimes they need that pharmaceutical medicines. You have got a big industry, Alpidum, you have got benzodiazepines, you have got lot of things, and this is there are some drugs which excessive use can cause insomnia, which is something like amantadine. You have got some barbiturates, you have got some. So you need to be careful with this particular stuff also. By people on with depression, on tricyclic antidepressants, because of this antidepressants, you get insomnia in some patients. So it's a slightly a dicey game, and you need to be we need to really try to put across what must be the problem with your patient and try to work on this. Yes, something of my favorite. I try to work as a clinical medical toxicologist, working in environmental medicine, and this group. I believe there is a high levels of copper, high levels of lead, as well as mercury can cause insomnia. So for me, I try to, apart from the diet history, apart from the other things, I would like to, some extent, I'd like to see if the patient is having lead toxicity or not. So that also is in my list, to do list, how to look into that. So these are the few things which I just believe that there are some simple therapies, and as I told you, just a kind of midnight snack helps a lot. My favorite is something like kava, which are herbs. We try to work with lot of things called bacohosh, and some things tea, something like some things are really helpful. The apple, what I say, is facilitates the sleep, and if you can take in the form of juice also, it's good. Or if you can take something like grapefruit, it helps in sleep. It helps solving that insomnia. Again, there are big takes, and so we would like to see the patient and see how we can, just by supplementing some calcium, or by just supplementing some magnesium or potassium, or still we would like to work it out something like with amino acids, something like taurine, tryptophan, and 5-hydroxytryptophan, or supplemental melatonin also is a kind of thing. So I try to treat this thing, particularly thing called sleeplessness, which normally people usually think that okay, it's a kind of this one, it's a chalta hai. No, it's going to cause you much problems. The early you pick it up, try to see that you get out of that particular thing. Don't become that insomniacs, and it is really not helping you in any way, and you need to try to take all these measures to get out of this problem, and prevent and reverse any forthcoming diseases. Thank you.